Okay, Dr. Mark Dailey here. Today we're going to continue our series on subclinical gluten sensitivities. We're talking about nutritional deficiencies, and really lack of normal absorption in the small intestines leads to predictable nutritional deficiencies. Calcium absorption can be poor, and this nutritional deficiency coupled with abnormal corticosteroid production can lead to accelerated osteoporosis. Iron, B12, and folic acid deficiencies are also commonly observed. This can lead to fatigue, which is a common complaint. It almost accompanies all of my patients, mild depression, memory loss, and greater risk for elevated homocysteine levels, which is a key factor in the development of heart disease. Poor digestive function leads to maldigestion and malabsorption of proteins, which will be reflected in amino acid deficiencies. Amino acids are literally the building blocks of our body and are vital for production of neurotransmitters. Can you see how all these link together? Such as serotonin. Now, serotonin has been termed the happy hormone. Low levels of amino acids can result in low levels of neurotransmitters. Our brain utilizes many different chemical messengers called neurotransmitters to communicate. They're made from amino acids found in protein-containing foods. Improper digestion and or absorption of protein generates amino acid deficiencies, which directly affects how we think and feel. The prevalence of this problem can be seen in the number of people benefiting from Prozac and other antidepressant medications. This generation of antidepressants are called SSRIs, or selective serotonin reuptake inhibitors. These medications basically prevent your brain from reabsorbing the serotonin naturally produced so that you experience a higher serotonin level. Serotonin is a neurotransmitter which is manufactured from amino acids. So what's that mean? Amino acid shortage, perhaps serotonin deficiency. So if you either A, do not get adequate protein, or B, can't digest protein well, or C, can't absorb amino acids from proteins, you'll develop amino acid deficiencies that ultimately affect brain function and other body processes. The approach taken in natural therapies is to look for causative agents such as maldigestion and malabsorption and treat the cause of the deficiency directly, thereby improving the outcome. In this case, addressing dietary intake of protein and the ability to digest it with sufficient stomach acid and digestive enzymes, and the ability to absorb is crucial to optimal health. In certain people who have food sensitivities, this one factor can prevent recovery from weight gain, fatigue, recurrent infections, and a cycle of chronic illnesses. Depending on the extent of the problem, a person may need to undergo extensive nutritional counseling to restore normal levels of vitamins, minerals, amino acids, and essential fatty acids. Natural therapies can be used with great success, providing the appropriate foods are being eaten and normal gastrointestinal function has been restored. Now, lactose intolerance is defined as the inability to digest the carbohydrate portion of milk products. The carbohydrate portion of milk is referred to as lactose or milk sugars. Lactose intolerance frequently accompanies gluten intolerance. Lactase is a specialized enzyme that aids digestion of lactose in milk products, is usually lacking in people with subclinical gluten intolerance as well. So lactase breaks down lactose or milk sugar in the same way that sucrase enzyme breaks down sugar or sucrose. Damage to the architecture of the intestinal wall and the subsequent decreased decrease in enzymes for lactose and sucrose digestion leads to problems in digesting dairy products such as cheese, ice cream, and all types of milk products. This enzyme deficiency is why people with subclinical gluten intolerance need to avoid pasteurized cow's milk products. As the villi on the intestinal lining heal from a gluten-free diet, most individuals will be able to tolerate raw or unpasteurized dairy products again within 9 months to a year. In other people, there will be a more or less permanent sensitivity to dairy products. However, in the initial 2 months of eliminating gluten, it is absolutely required to avoid all milk or dairy products because they'll inflame the intestinal lining just like gluten does and prevent healing. This includes the complete elimination of pasteurized cow's milk products like cheese, yogurt, cottage cheese, and milk. Goat's milk, yogurt and goat or sheep milk cheese like feta cheese and other cheeses are acceptable alternatives. In this instance, eggs are not considered as dairy products. Raw or unpasteurized dairy products are healing foods for the damaged GI tract. In the next video, we're going to talk about multiple delayed food allergies and allergies versus intolerance. I think you'll find that real interesting. Thank you so much. Have a great day.